Hi there, my name is Kathy Klein and I'm the founder of Medicare Quick. Today I'm going to tell you about a little-known law in California that allows you to change from Medicare Advantage to Medigap even if you don't qualify medically. So let's take a look. Well, first of all, if you're watching this video, I already know that you're interested in changing from Medicare Advantage to Medigap and you live in California. Be aware that this law only works if you live in California. If you don't know the difference between a Medicare Advantage plan and a Medigap plan, stop this video. You'll need to go right away to medicarequick.com/MMD and watch that video first. Okay, now you know the difference between Medicare Advantage and Medigap, and you want the freedom to see almost any doctor in the United States, including mobile doctors. And remember, you must live in California. This won't work for you if you don't live in California. Now, if you don't qualify for a Medigap plan because of your health, how can you get what you want? You might be in luck because if you live in California, you're covered by a little-known law that might allow you to get a Medigap without having to qualify medically. It's section 10192.12/D. You can get a copy from the California Department of Insurance. Basically, what it says is that if your current Medicare Advantage plan offers a Medigap plan in California, and that plan reduces any of its benefits, any amount, even a penny, or it terminates your doctor or other provider except for good cause, but it doesn't apply if your doctor leaves the plan voluntarily, then you can get a Medigap plan with that same company and they can't deny you because of your health. You'll be able to get a Medigap plan with that company or one of their subsidiaries. But what happens if your insurance company doesn't offer a Medigap plan? Don't worry, you still might be able to get a Medigap plan. If the Medigap plan increases its premium by 15% or more, increases physician, hospital, or drug copayments by 15% or more, reduces any benefit under the plan, terminates your doctor other than for good cause relating to the quality of care, then you'll be able to get a plan with any insurance company that sells Medigap in California. Basically, if your plan sells Medigap and has any increase or decrease in benefits, or if your plan does not sell Medigap and has a 15% increase or decrease in benefits, then you'll qualify. But you are limited to certain plans. Those plans are Plan A, B, C, F, high deductible F, K, L, M, and N. It does not entitle you to get a Plan G or one of the new, innovative, or extra Plan F plans. And you can only make the changes during the annual enrollment period, which is between October 15th through December 7th of every year. But these changes are complex. We do not recommend that you wait until the end of the annual enrollment period. We recommend that if you want to make a change, that you do it at the beginning. And the law does not apply during the annual disenrollment period, the open enrollment period, special election periods, etc. It only applies during the annual enrollment period between October 15th and December 7th of every year. Now, you're saying to yourself, why hasn't anyone told me about this? I have a broker, I have an agent, I've tried to get a Medigap plan in the past and no one's ever told you. Well, there's a perfectly good explanation. Your agent or broker might not know. There are plenty of agent and brokers who do not know about this rule, this law in California. They might also not be an expert in Medicare. They might be offering Medicare services on the side, and they might not even live in California. Also, your agent or broker might not get paid or might not get paid enough. Medicare Advantage plans can pay as much as $605 in California versus Medigap's commission, which could be lower. And some insurance won't even pay a penny for your broker or agent for doing this type of plan change. And like it or not, your broker or agent does have to get paid in order to stay in business. Some brokers don't want the risk or the stress associated with these type of changes. It can be extremely stressful. And make sure that you work with an experienced broker when making these type of changes. It can be very tricky, things can go wrong, and don't worry, Medicare Quick is very experienced in these type of plan changes. If your plan doesn't have an increase or decrease that qualifies you for guaranteed issue of a Medigap plan, don't worry, there's still hope. You can apply for a PPO style Medicare Advantage plan if one exists in your area. You can also stay on your existing Medicare Advantage plan and just pay the cost of the out-of-network doctor. You can also, as an add-on to your Medicare Advantage plan, this does not replace it. You could enroll in a telephonic doctor service that allows you to see general practitioners from the comfort of your own home. Now, we do offer plans that have no copays or deductibles for $14.95 per month. That's starting for an individual. To learn more about that, go to medicarequick.com/teledoc. You can also, if you move out of your coverage area and lose your Medicare Advantage plan, you will have the guaranteed right to purchase a Medigap policy. You can also switch from one Medicare Advantage plan to another that has a policy of allowing their Medicare Advantage plan members to switch to their Medigap during the annual enrollment period. Now keep in mind that just because they have a policy of allowing this doesn't mean that they have to. So they might change their policy and then you would be out of luck. You can attempt to get a Medigap policy that will accept your medical condition. Now, if you'd like to understand your choices, please call or email us today for a free consultation. The phone number is 866-445-6683, or you can go online to medicarequick.com/contact-us. Thanks so much for watching. We're looking forward to working with you.